Welcome, listeners, to Connect the Dots. I'm Alison Rose Levy, and I'm here with you every Wednesday at 10 a.m. Eastern Time on the Progressive Radio Network. Each week on Connect the Dots, we connect the dots between individual well-being, the well-being of our communities, the well-being of our food, water, air, and earth, and the well-being of our society, which we all know is not doing very well right now, as well as the ecological balance and interconnectedness of life here on planet Earth. I'm a long-standing journalist of the environment, food, health, public policy, the media, and popular attitudes. And each week on the show we talk with different journalists, authors, activists, scientists, advocates, economists, and a whole host of people who each hold different perspectives on our interconnected world. Today, I'm really delighted to have back with us on Connect the Dots, because I believe it's his second appearance, Jim Naureckas, who's the editor of Fairness and Accuracy in Reporting. Full confession, this is an outlet for which I have been honored to contribute, and one that I've supported and whose work I follow very closely and who've done so for a long time. In my world, this is kind of part of, the group of, people who really helping to redress the tremendous corporate media influence that invades all of the understanding of so many Americans, and to really provide accurate news, honest journalism. It's a terrific outlet and one that every listener to this show should follow, as I do. So welcome back, Jim Naureckas. So happy to have you here with us today.
Thanks for having me back on.
So, Jim, the usual beat of FAIR is, kind of looking at what the media is doing, how they're spinning stuff, what they're omitting, and what they're promoting, and really kind of providing a very important counterweight of honest information. Over the last couple of months, you have also focused intently on COVID-19, on the pandemic, on the coverage of it, on, its evolution, where it is and what's happening, on the governance and policy decisions concerning it. To me, that makes complete sense, because it is the huge story of our lives right now, and it's not that you exclude other coverage, but and maybe I've missed it, but I've never seen FAIR, really kind of focus in on something, and of course this is a very huge something. How did you make the decision to do it, and why do you feel it's important to do it?
It is something that we've done before in times of war. After September 11th, we weren't talking about much other than the aftermath of September 11th. There are times when the country focuses on an issue and the media focus on an issue, and it's there is so much attention being paid by the media to this one thing that we sort of naturally gravitate towards it. It would be different, I think, if we thought that the media were sort of capriciously focusing on something that wasn't all that important. But this is something that is affecting everyone's life and presents, I think, a danger that some people still don't appreciate how serious this is. There's sort of a tendency to compare what has happened, how many people have died from COVID to date, and compare that with other things that kill people, as if we haven't entirely changed our behavior in order to prevent the spread of COVID. You can't think we shouldn't have done what we did because it only killed X number of people. You have to have some estimate of how many people would have died if people hadn't changed their behavior. And that's what you balance the costs of changing your behavior against.
That's a really good point. That's really an interesting counterweight, because we're not doing the statistics on, where would we be now had there been no lockdown, no masks, and we still have very inadequate testing. We hardly have any tracing at this point, which, are all the sort of methods that have been used to try to bring down the numbers here. We never talk about where it would actually be, although I have to say, as a native New Yorker, which has been, a major hotspot, and therefore in a situation where, I know many people who have lost loved ones, who themselves have suffered from this, and so it can seem abstract, perhaps to people in an isolated location of some kind, a less dense location. It's kind of among New Yorkers, there's very little, question about what how contagious or difficult this is. But for people elsewhere at some kind of distance, it may seem more abstract, and therefore the reporting becomes really essential. Do you do calculations? Do you take the data you find and kind of see where it would have led? Have you looked into that at all in terms of, trying to calculate that, or is there anyone that is kind of keeping track of where we are now and where we might have been? I think Sweden has been kind of the poster child for let's take a more relaxed response, let people go about more, hope that people will develop herd immunity, which is, one of the kind of counter proposals, shall we say.
Right.
And then there's a myth that Sweden, in fact, has solved, that problem that way. But that's not actually the case. Is Sweden a good poster child to look at, the open all the doors scenario from your perspective, or, are there other ones that are better, or,
Yeah, I think that looking at the numbers is really important. Trying to figure out just how dangerous this pathogen is, and what are the responses that can affect how many people it infects. I think these are crucial things to do. And I think it's very important to be looking at not just different places within the United States, but different parts of the world, and look at what kind of responses people have had and what kind of results they've gotten. And Sweden has gotten a lot of attention because it's seen as a sign that you really don't have to worry too much about this thing, and can take more of a lackadaisical attitude towards it. Mm-hmm. And I think that this is just really misguided for a couple of reasons. One is that Sweden has not had just ignore it as their approach to the coronavirus. They have taken a number of steps to try to prevent banning large gatherings and encourage people to work from home and social distancing and so on. So it's not sort of a control group of what if we had done nothing. Mm-hmm. But they have, not had sort of shelter-in-place orders. They haven't closed down their economy to the extent that other places have. And the results have been, compared to countries that are similar to Sweden, much, much worse. There's sort of a natural experiment between Sweden and Norway, which are similar Scandinavian countries. They both have fairly dispersed populations, which I think is an important factor in how quickly coronavirus spreads. And the overall, the death rate from COVID in Sweden has been 6 times worse than the death rate in Norway. And at this point, Norway has basically stopped the spread of the coronavirus. And so the current rate of infection in Sweden is 20 times as bad. 20 times as many people are getting COVID in Sweden as in Norway, which seems like a pretty clear indication that Sweden's approach has been a failed approach, and that you can't do that without killing a lot of people. And the notion of herd immunity is something that gets tossed around a lot.
Yes.
And people have to understand that herd immunity. There's not a precise figure that you can say. If you hit this point, you'll have herd immunity. But people think of it as being in the neighborhood of like 70% of the population. In some parts of Italy, which are the hardest hit, it's believed that over 80% of the people are infected. So that is the level at which you might consider that the virus is going to stop on its own, because the people who, if you have a case of it, you probably won't meet someone who you can pass it on to before you're recovered. That's what herd immunity is. And to have to get 80% of your population infected with COVID, outside of places like Italy, I don't think there's any place that has had that level of infection, and it's been devastating in Italy. The death rate is something that is hard to figure. The rate of mortality if you are infected is very hard to figure, because not every infected case makes you sick, and therefore it's hard to tell who's been infected and who hasn't. But the sort of best guess for how likely you are to die if you get a case of this coronavirus is about 1%. So if you're talking about 80% of your population being infected, that is 0.8% of your population dying. And in the United States, that's something like 3 million people. So when people talk about herd immunity as a strategy, they are contemplating millions of people literally dying, which I think is just not, to me, that's unacceptable. And I think that if we had a discussion that actually used numbers instead of just tossing around this phrase as a kind of buzzword, I think most people would say, no, it's not acceptable to have millions of people die in order to...
Because this disease is far more contagious. I mean, I've had people coming on, commenting on my Facebook page or telling me in real life it's only 1% of people. But this is extraordinarily contagious.
Right.
Not everyone, manifests symptoms. And also, from what I've read about herd immunity, we have the common cold. Nobody has herd immunity for that.
Right.
And that's another type of coronavirus. And so, the assumption that every type of virus or every kind of infection will produce a neutralizing antibody response is just not true. So in fact, there may not. I mean, there's actually quite a lot of doubt about whether there will be development of herd immunity.
Yeah,
how long,
that is an important point. I mean, the question of whether you can be reinfected with the coronavirus is an open question. It seems like if it happens very rarely in the immediate aftermath of getting the COVID-19. That does not mean that a year from now you will still have the level of immunity that you do now. This disease in humans is only like 6 months old.
Right.
It's very early to tell whether, if you get the flu, then you you won't get the flu again that flu season, but you may get the flu again next flu season, and that could be the case with the coronavirus. And apparently, the coronavirus is a part of a family of coronaviruses, and apparently that's fairly common in coronaviruses that they produce short-term immunity but not long-term immunity. That's my understanding. I'm not positive that's the case, but that's my understanding. The question about the flu is so one other thing that you mentioned that I want to talk about. When people say it's not much more dangerous than the flu, there are two halves to that, as you say. That there's the question of if you get it, how likely are you to die? And it looks like you're about 10 times more likely to die with the flu than with the coronavirus than with the flu, and that's much more serious. But it's also the case that the coronavirus is much more infectious in part because we haven't had any experience with it before, and in part because we don't have a vaccine for it. We do have vaccines for the flu. Not everybody gets vaccinated, but enough people get vaccinated that it slows down the spread of flu. And so about 10% of the population gets infected with the flu every year. And so you have 0.1% of 10% dying, which is 0.01%, which is still in a big country. I don't think we take the flu seriously enough, frankly. I think it's a serious disease that we should do more to prevent. But when you're talking about 1% of 80%, that's obviously a much bigger number than 0.01%. And people are not looking at both halves of the equation when they're talking about how serious this disease is.
Now, 80%, you're saying 80% of the population will get it either asymptomatically or symptomatically.
Right, right. Not 80% will get sick, but 8%. That is based on Lombardy in Italy, which seems to be the place that's gotten the worst infection of any place. That seems to be perhaps the upper limit. And even they were shutting down in Lombardy. It's not necessarily the case that if they had done nothing in Lombardy, the infection could have even been higher. It's possible that you'll get near 100% infected with this disease. I don't know.
Is that considered to be, because there are different strains of the coronavirus, and in fact it's mutating, so more strains upcoming, which is not that good news really.
Right.
But is the Italian strain, for example, considered to be more virulent, or different in any way from the Asian strains?
Yeah, and there's a thought that there are people who were coming from China and people coming from Europe, both infected with the coronavirus, and the strain from Europe is the one that predominates in the United States, and there's some assumption that because it has spread further and faster, that therefore it's more infectious. Though it also, it's hard to separate out the biological properties of the virus from the social reaction to the virus. And I think that both Washington and California, which were places that had early cases of COVID-19 coming from China, reacted more quickly and more seriously than New York did, which had infections coming from Europe. Our government here waited way too long, and before putting a shutdown in effect, which is why New York has the kind of outbreak that it does, and why it looks so different than other states. I think it has less to do with. I mean, it in part has to do with the fact that we take a lot of public transportation here. We live very densely, but primarily it has to do with how late we waited before taking it seriously.
Mm-hmm. So we can't separate out from that whether the European strain is actually, a more virulent strain. It's, in terms of both in the numbers of people who will become symptomatic as well as the virulence of what they experience. I mean,
my understanding is that this is just done epidemiologically, that that people are looking at how quickly it spread and gauging how infectious it is based on the speed of that spread. And there's so many variables in that. The countries in Asia have, by and large, done a much better job dealing with the coronavirus. And also, Australia and New Zealand are also places that have had a fairly successful response to the coronavirus. And that is so the strains of the virus that are going around in that part of the world are going to look less infectious because, for example, as just one variable, the East Asian countries were much quicker to encourage people to wear masks. And in the United States and I think in parts of Europe, the idea of wearing masks was kind of discouraged at first. And so, the virus that circulates where people are wearing masks, if masks are effective, will look less infectious because less people get infected. But is it the virus or is it the mask?
Yes, that's right. Yep. So we can't really know that. I mean, the reason I ask that question is because the variety of different symptoms, and characterizations of this, as well as its aftermath, things that it has passed through someone's system, and in some cases it leaves behind, other harmful health effects, that result from it that can become long-term, chronic and long-term and everything. So, I was also wondering about that because even in the reports of people reporting on themselves or their family members, there's just a wide variety, it seems like, of symptoms. And,
It is. It's a kind of a striking disease, I think. I have not, I haven't focused so much on the medical aspects of the pathogen, but it does seem like it produces a wide variety of responses from no symptoms to respiratory symptoms to digestive symptoms, nausea, diarrhea. It attacks the kidneys. It seems to have a lot of different ways that it can express itself, and whether that has to do with different ways of people getting infected, I really don't know. I'm curious about that. Whether there are different kinds of transmission. I mean, it seems like it's mostly transmitted through the air, through droplets of saliva or mucus in the air, and is breathed in and attacks the lungs. But are there other ways of transmission that, is it possible to get it orally and have it be mainly a digestive illness? I don't know. This is just me speculating.
Yeah, no, you mean, in other words, one could eat some of that contaminated meat that is not going to be circulating. So this is completely, it's a hypothetical rather than a actual risk. But, one could eat something that was infected with it, for example, and then, it pursues a gastric route. I've never heard that hypothesized. I do because I have, a 25-year background in health, I'm kind of interested in the health aspects of it, and I do look for things like that. And
I do think that it's important. The kind of genre of story that I've been looking for more of is stories that analyze how transmission happens in the real world, which I think is more useful than sort of, laboratory analysis of how it could possibly be, how it can theoretically be transmitted. There is a lot of, not enough, but there are some efforts to trace the chain of infection from one person to another to see how it's being passed along, and looking at what kinds of situations have led to transmission. And in places where they have really done this thoroughly, like in China, for example, it seems like most of the transmission is happening in indoor situations, from person to person, either through the air or through handshakes or hugging. Sometimes through shared food, which might reflect on the gastric idea. But it does not seem there don't seem to be a lot of cases of either people passing by someone on the street and giving it to them, or someone handling something like a package and leaving that and having someone else pick that up. If that's happening, it's not happening so much that it's showing up in the research. And so I think it's useful to allay some of our anxieties about this, to look at what the actual venues for transmission are, what the likely ways that it seems that people have passed on this illness. And not to say everybody go to the beach, but I think that there may be excess worry about people in parks, which do not seem like a major route of transmission, versus the home or the workplace or indoor social events, which seem to be more serious routes for people getting this disease.
Yeah, I mean, I stopped using the New York subway several weeks prior to when this whole thing went full blown, because I immediately reasoned that with everybody traveling around through the subway and in close proximity and in air, breathing a car, breathing, etc., and that there could be a problem. And of course, that's the case. And there's a lot more to say about the New York subway as a vector and what you could possibly do to alleviate that. But the other thing that I read that I found very interesting was that a group of diners in a restaurant got COVID because there was several people who had it in the restaurant, and it got into the air conditioning system. And so, the idea that either heat or cooling systems, which may deploy water internally or whatever, could become carriers in indoor space. To me, that would seem to make a lot of sense, more so than, package that somebody touched.
Right.
And then it sat, and then, So, I mean, I've been taking precautions on packages and everything, but I find it somewhat unconvincing as a really serious vector, although I suppose that for somebody with a very fragile immune system, they could be at higher risk of that. But I think the whole, I think the air circulation systems, whether cooling or heating in buildings, and that's, they exist in the subway too. So it's circulating air, and then, you might not have to be sharing hummus with somebody, to get it,
It is fascinating to see those maps of like where people were sitting in a restaurant and who got infected. And I don't know that like air has been circulated from like one floor to another. I'm not saying that hasn't happened, but I have not seen discussions of that kind of like long distance transmission through air ducts. But the 6-foot rule that people use definitely does not apply in like a restaurant. In an enclosed space, people have definitely gotten infected, from much further away than 6 feet, just by sharing a meal in the same space with someone. I was reading a discussion that was talking about how you have to think in terms of both how many particles of virus a person is putting out and how long you're exposed to them. I tend to think of a virus being like, you get a virus in you and it multiplies and suddenly you're infected. And really, apparently, it's not the case that like a single virus is going to infect you. That you need a dose of virus in order for it to get going with the kind of chain reaction that creates an infection. And people say, they're obviously guesstimating, but they're talking about like 1,000 viruses have to get into you in order to get a reaction going. And if someone is infected and is sitting across the room from you, in a minute, you're probably not going to get very many viruses from them. But if you sit there for an hour while you're eating a meal, you can get 60 times whatever you would have gotten in a minute. And so that's why, like passing people on the street is not too dangerous. But standing and talking to someone for half an hour is a much different story. And so when people there's some talk about opening up restaurants with lower without many people in them, with like only 20% capacity or something, and that's not going to infect as many people because there's only 20% of as many people in there. But I don't think that just having the idea that having more space between the tables is going to prevent infections from happening, I don't think is looking at the case studies of how people are getting infected. I think it's just sort of people wanting that to be true and so assuming that it is.
Yeah, that makes complete sense. What about the 14-day quarantine? Because, with so little known about the whole thing, this has suddenly become, some kind of assumption that, 14 days, after 14 days all will be well or something. But, I've seen, somebody from Harvard, from the Harvard School of Public Health commenting that, in fact, it could be longer than 14 days. I mean, why would, it necessarily follow that particular rule? And they said that, their assessment is that in 10% of the population, it could be 21 days, it could be a month. So we're sort of basing a lot of these guidelines on, this particular early assumption. Have you seen any literature where that's been modified? Because that would seem to make, kind of a big difference.
Yeah, I mean, I remember the early studies that where the 14 days came out of, and it was based on looking at cases, in Wuhan, I believe, and figuring out when people were infected, how long it took for symptoms to come out, and by the sort of average length of time for symptoms was 5 days.
Okay.
And 14 was like after 14 days, very, very few people were coming up with symptoms. Now, this study, I think, doesn't take into account people who never express symptoms. And, whether how long it lasts in people who don't have symptoms is, I think, pretty unknown. And maybe that's what this Harvard person was talking about. Because the 14 days is not if you have symptoms, you'll be over it in 14 days. You'll be apparent in 14 days. If you're going to get symptoms by the 14th day, almost certainly you will have had symptoms. And really, by I think the 10th day, like 99% of people who were going to get symptoms had symptoms by the 10th day. And then, it can go on for weeks after that. But you'll know it. That's the point of having the quarantine is the idea that you will know whether you're infected or not by 14 days. But that's not really true because of the asymptomatic part. And it's really like how you study people who are asymptomatic. It's really tough because they don't have any symptoms, right? They don't show up in studies because they look just like everybody else. You can only find asymptomatic people by testing widely, and finding the people who had no reason to get tested, or maybe people who are exposed and are getting tested, got an infection, don't have any symptoms, but I've heard it said that people confuse people who never have symptoms with people who haven't had symptoms yet. Those are two different groups. And I've heard it said that not getting any symptoms at all is rather rare. But I think it's a big gray area because they're so hard to study. And also, it's not clear how infectious people who don't have symptoms are. They're not coughing and sneezing, which is good. But are they putting out viruses just by breathing and not knowing it? And it does seem like the 5-day lag between infection and symptoms is pretty long, and that's one of the things that makes this disease so dangerous. Disease like SARS, which is also a coronavirus that has a high fatality rate, and it did not turn into a worldwide pandemic like this, in part because the symptoms come on earlier, and so you don't go around infecting people before you know that you're infected.
Right.
And that was why it could be contained, and we don't have this memory of everyone shutting down their lives because of SARS, because it was much more obvious who was infected. And this is why really the main reason that you should be wearing a mask when you go out in public is because you don't know whether you're infected or not. And if you are infected, having that mask is going to greatly reduce the chances that you'll pass on your infection to other people. Which is why I feel like a lot of people are not wearing a mask because they're not worried. And it strikes me as being really sort of self-centered to not realize this is not about protecting you from getting infected. It's about protecting other people from you infecting them, and people who may be in a much more vulnerable position than you are. You know, you may be young and healthy and think that you will survive even if you get this disease, but you may be passing it on to someone who is not young and is not healthy, and you know, the fatality rates for elderly people are quite shocking. This is a very, very deadly disease in the populations that are most vulnerable. And
you know, the 60 and older or the 80 and older, what populations, you know, what statistics are there for the various populations, if you're aware of them? Because, you know, if we're talking about other people, somebody, you know, isn't thinking about their grandparents or whatever, you know.
Right.
But, you know, like, what are we seeing? Like, what, 1 in 8, 1 in 10? Like, what are we?
I think in Italy, in the most affected parts of Italy, like 10% of everyone older than 90 is dead from this disease. It's really a scythe. You see reports from nursing homes where just a big chunk of the population of a home will be wiped out by this thing, just going from one resident to the next. It's grim, and you know, it really, when you're thinking, I think it's easy to think in terms of, like, you know, when you hear 1%, that sounds low. You know, 1%. I mean, in your mind, you think that's a tiny part of the population. When you were talking about actual people and the populations that 1% represents, it's really very serious. And you know, you see people, I think, on the more sociopathic end of the political spectrum, talking about how, you know, the people that are dying they're old anyway. You know, the life expectancy of an 80-year-old woman in the United States is 11 years. It's not like you're on death's door when you're 80 years old. Many people have many years of life ahead of them, and it's cut short by this illness, and it does not have to.
You know, this goes to the question of American individualism, you know, because we have shredded the social contracts. You know, we've been taught to otherize and discount other portions of the population than our own particular group or silo. We've been taught that our survival actually depends on individual self-reliance over social caring, you know, and social safety nets and stuff. And so that's all been a political process of, you know, many decades. But then the end result is that you know, wind up with people who believe and have been taught to believe and have been taught to survive living by the belief that everything is under their individual control. You know, even you know, as we were waiting for the show hour to come, listening to some overnight broadcast, you know, of people laughing hysterically at the end of another program, talking, you know, with the belief that, you know, their own personal power in some way was, you know, tremendously protective against anything. And, you know, it's actually, you know, must be comforting, but it's really a form of denial. You know, that you're a part of a greater system or group, or that your group is also connected to the well-being of other groups in the society, or that we should care about other people and stuff like that. You know, and so there's actually been, even among those who consider themselves good people or who are religious or believing people in some other way, have this this kind of abbreviation of social caring, and this individual over self-reliance, then it's showing up right now.
There's a strong parallel between the way that we approach healthcare and this individualistic, it's your responsibility, it's up to you to come up with the money for health insurance, rather than a Medicare for all approach.
Right.
And then it's your responsibility to keep yourself from being infected, and your choice, whether you want to protect yourself from being infected. It's related to the economic system that we have, where it's sort of predicated on the sink or swim model, that if you don't make yourself a success, then you're a loser, and it's your fault. I don't think it's surprising that we have similar attitudes when it comes to the response to an epidemic and the response to just everyday life, making a living. And I think it is the way that the debate over the shutdown has gone has framed it as a sort of binary, like either people can stay at home to protect themselves from the virus, and run out of money for food and necessities, or they can go back out into the workplace and risk their lives and get paid. And of course, there is a third option there, where you can have people stay home, protect the society from this infection, and use the resources of society to help people through this time, to give them the resources they need so that they can stay home. And in Wuhan, at the height of the epidemic, everyone was getting food packages brought to their door, because they were so intent on stopping this thing that like you couldn't go out to get groceries, but you weren't being left to starve. People were bringing, people with masks and gloves and hazmat suits were bringing you packages of groceries so that you would have stuff to eat during this time, and that got them through the strictest time of quarantine, and they were able, despite having a full-fledged outbreak of this disease that no one had ever seen before, they were able to get it under control, and there is now some semblance of normal life even in Wuhan, because they took the disease seriously and they took the responsibility to support people through the disease seriously. Whereas you have like when we had a completely inadequate one-time check for $1,200 given to people, and they made sure that if you didn't have a Social Security number, if someone in your family didn't have a Social Security number, you couldn't get the check. And the idea was to make sure that none of those sneaky illegal aliens were getting the support check. And the point of the support check is both because you don't want people to starve, and also because you want people to stay home and not be working and spreading the virus.
Right.
These are
doing a social task.
Yeah, and to see like certain people as unworthy of getting the support is missing the point. It's not just missing the humanity; it's missing the logic of why you're doing this in the first place. You want people to be staying home because you want to stop transmission of the virus, so that the virus will, the epidemic will burn out, and then we can go back to having normal lives again. And if you make sure that by design, a large chunk of the population does not get the support, and so is forced to go out and work, then you are ensuring that the virus will keep circulating. The epidemic will stay alive. It will still be out there. Whenever you go back to try to resume your life, the disease is still out there, which is what is happening now. People are trying to resume normal life, and you can't, because if you have the patterns of behavior that you had when the virus got here, you will have the transmission rates that you had when the virus got here, and you will be heading, as we started out in this conversation, the endpoint of normal of business as usual, of not doing what it takes to stop the spread of the virus, is millions of people dead. That's the no action alternative. So you need to have a plan to, the minimum is that you need a plan to slow down transmission of the virus. But if you don't have a plan to stop transmission of the virus, then you have to have the slowdown plan forever, or until a vaccine comes, which, who knows when that's going to happen.
Yeah, or they may have problems with it because of the very herd immunity problem we've been discussing. We have about 6 more minutes left to the show, and I just, we're right on point here for, where I was kind of hoping we would take this, which is, there is now talk of relaxing the rules and beginning to get back to normal, and yet without testing, there's really, is anyone projecting what will happen? What is about to happen if these social decisions are made? Because if we open up, and exceed to that, what are we actually looking at on the health side?
Yeah, I have been paying very close attention to the numbers in the states where they've been relaxing the rules, and I have actually been relieved to see that in most places there is not a big explosion of new cases, and and it's worth thinking about why this hasn't happened. The places where restaurants have reopened on a limited basis, when you look at the data for how many people are using restaurants, there's an app, Open Table, that keeps track of restaurant reservations, and restaurant use in the places that have reopened is still down by like 90%, or someplace 80%.
People are just not doing it.
Yeah, and that I think has a lot to do with why we haven't seen a big jump. It's not that you can't get infected in a restaurant; it's that there aren't many people in the restaurants to get infected, and so you're not seeing a big jump.
They're making a wise personal choice in that regard. Yeah,
but it's the fact that there hasn't been a big jump is missing the fact that what you want is to have a continuous decline, right?
Yes.
To keep infections coming at the same rates that they have been coming, which is this situation that most states in the country are in. It's not a state that you should be aiming for,
right?
Because there are, when they relax rules, it's not going back to normal. It's not going back to the way things were before. Your economy is still going to be greatly hobbled by the limits on people's behavior, both the remaining official limits and the limits based on people's rational realization that if they do certain things, they're risking a deadly disease. To go on in this sort of half-life of coming out once in a while and maybe having a restaurant meal where half the tables have been removed, it's not going to produce a thriving economy. It's going to produce an economy that we're in the deepest recession that we've been in since the Great Depression. The unemployment rate may actually have already matched the depression rate. It's not going to bounce back if the virus is not gone. And I think people really should be thinking about how to get rid of this virus, which is something that there are countries in the world that have taken a different road, where the idea is to get rid of it and not to keep it from overwhelming your healthcare system. And those countries, I think, as the year goes on, are going to be looking more like normal countries in the 21st century, and not look like what the United States is going to look like, which is a country that is under this kind of battle with the virus for the indefinite future. Yeah.
Thank you so much for being with us today on Connect the Dots, Jim Naureckas. That's a dire but I think very practical and realistic warning. Jim is the editor of Fairness and Accuracy in Reporting, which is online at fair.org. You can follow his COVID reporting as well as their other reporting on the media at fair.org. Terrific articles, always very high quality. Really love your work. Big fan, Jim.
Thank you so much.
Of it. Yeah, thank you for being with us today, and
I'm glad
really
you had me
fun
on.
to have you back, despite the topic. But I think this merits the seriousness that you give it. Thank you, listeners, for being with us for this edition of Connect the Dots. We'll be back next Wednesday at 10 a.m. Eastern Time. I'm Alison Rose Levy.